Hi everyone, I'm Aarsha Taneja. Today's topic in the Nutrition Initiative is iron deficiency and anemia in teens. This is one of those issues that is incredibly common, often invisible until it's fairly advanced, and genuinely manageable once you know what to look for. Let's start with why we're even talking about this. Iron deficiency is the most common nutrition deficiency among adolescents worldwide and more common than any vitamin deficiency you typically think of. Teen girls are affected at notably higher rates than teen boys for reasons we'll get to shortly. And this isn't just a lab value issue. It's linked to real fatigue, poor concentration, and measurably lower academic performance. The tricky part is that it often goes undiagnosed because the early symptoms, like feeling foggy and tired, are exactly the kind of things a busy teenager or the adults around them tend to chalk up to normal teenage life. Have you ever wondered how the oxygen in your lungs reaches the tips of your fingers? Iron, as hemoglobin molecules inside red blood cells, physically carry oxygen from your lungs to every tissue in your body. It also supports energy production at the cellular level, which is also why fatigue is such a common symptom of low iron. And for teens, iron is essential for brain development and cognitive function. To put it simply, every system within the body is dependent on iron. These two terms may seem confusing and very commonly used interchangeably. I want to take a moment to clarify the difference between the two. In iron deficiency, the body's iron stores, aka ferritin, are running low, but the red blood cells are still being produced normally. However, in iron deficiency anemia, the stores or ferritin are low enough that red blood cells production becomes impaired. Deficiency is the early silent stage, while anemia is the advanced stage with visible symptoms. Why are teens specifically such a high risk group? A few things are converging at once. First, rapid growth within the body requires more iron for more tissue, more blood volume, so there's more demand. Second, for teenage girls, menstruation alone leads to increased iron. This is the single biggest reason between the teenage girls and teenage boys gap. Third, typical teen diets are often low in iron rich foods like legumes, seeds, nuts, greens, and red meat. Finally, teens are prone to faster iron turnover due to the intense training and exercise they go through. Now it should be easy to correlate why anemia and iron deficiency is common among teens. By the way, I just want to say that I'm not saying not to exercise. I just want teens to be more mindful of their lifestyle and diet. So, what should we watch for with anemia and iron deficiency in teens? The first one is fatigue. That doesn't go away even with enough sleep. That mismatch is a big clue. Physically, you should look for pale skin, brittle nails, and pica, which are cravings for ice or non food items. That's really specific for low iron. It can also affect your brain. You can have trouble concentrating, headaches, or being more irritable, which often just gets mistaken for mood or attention issues. If you're getting short of breath or your heart is racing during normal, everyday activity, not just exercise, that's a sign your body is struggling to get enough oxygen and you should get checked promptly by a doctor or school nurse. Let's talk about food, because diet is one of the easiest things we can actually control. There are two types of iron: heme iron from meat, poultry, and fish, which is absorbed very efficiently. It's also the most bioavailable source we have. Non-heme iron is from beans, spinach, and fortified cereals, isn't absorbed well on its own. But here's the trick: if you pair it with vitamin C, then you can absorb way more. Think beans with bell peppers or spinach with citrus. On the flip side, coffee, tea, and calcium rich foods can block iron absorption if you have them in the same meal. So, timing them separately from your iron rich foods can make a real difference. So, what does this look like in practice? First, routine screening for the highest risk groups: teen girls who menstruate and athletes, so we catch the low iron early. Second, practical dietary counseling. Iron rich foods and pairing them with vitamin C, which is something we can actually do ourselves. Third, supplementation. Only if a healthcare provider recommends it, though. This shouldn't be self prescribed too, as too much iron has real risks from stomach issues to serious toxicity. And finally, follow up blood work to confirm it's actually improving and not just assuming that it works. To bring it all together, iron deficiency is common and it's often silent, and the encouraging part is that it can be highly treatable once identified. Teens face a unique combination of risk factors, such as growth, menstruation, diet patterns, and activity levels, that make this age group especially worth paying attention to. Watching for early symptoms rather than waiting for full blown anemia gives the best chance to intervene early and simply. And ultimately, simple dietary changes guided by proper screening can make a real and lasting difference in how these teens feel and function every day. Thank you so much for listening to me, Aarsha, about my presentation, Iron Deficiency and Anemia in Teens.